The government of Egypt has made tremendous strides over the last 3 decades in improving the health of its citizens, but problem areas remain. Compared to many other governorates in Egypt, the health indicators for women and children in 2000 were poor in the Aswan governorate. For every 100,000 live births, 135 women died in childbirth. For every 1,000 live births, 27 infants died before their first birthday. And the family planning needs of nearly 1 out of every 5 women were not being met. The primary issue in this situation was not lack of funding, medicine, or technology. It was a lack of empowerment, inspiration, and commitment among the frontline healthcare workers. Healthcare staff were not available all of the time. Patients were frustrated, and most seriously, those whose health was most fragile were not getting prompt and adequate care.
I've been here since 7 o'clock in the morning. I have my son and the papers, and I cannot find anybody.
The Aswan Health Directorate recognized that the root cause of the problem was the lack of leadership at all levels of the healthcare system. To help the Aswan Governorate address these concerns, in 2002, USAID's Office of Population and Reproductive Health sponsored a leadership development program, co-led by Management Sciences for Health and Egypt's Ministry of Health and Population. A new approach to leadership development was introduced in Aswan, one that focused on teams of healthcare workers, not individuals.
The leadership development program is different from other programs in many aspects. It is a process over time. It is learning in action. It is a process of attitude and behavior change. It is a combination of workshops and team meetings in their workplaces to be in action and to implement activities with their teams and with their communities to make a difference and to produce better service results.
The Leadership Development Program consisted of a series of 1- and 2-day workshops spaced over a few months. In the workshops, teams learned leading and managing practices and applied simple planning and management tools that could help them succeed. Between workshops, the team used what they learned in their local settings, scanning their environments to understand the health challenges in their communities, and then planning and prioritizing the actions they needed to take to address the primary healthcare challenges. The program was launched with 10 teams of health personnel. They focused on addressing needs in family planning and maternal and child health and began showing measurable results in the first year. At the end of 1 year, the funding for the program is finished, but the program participants decided to continue the Leadership Development Program on their own, taking it to new teams and health facilities in the Aswan Governorate using their own resources.
We didn't know anything about this program in the beginning, and we didn't know anything about improving leadership skills. We didn't realize how important this program was.
Before, everybody was working on their own. If I was responsible for something, I was doing it without coordinating with other people.
People started to think about how to improve, how to create things. In every workshop, we used to just sit and listen.
In the beginning of the training, the nurses used to come and sit like wooden chairs. There were no comments, no discussion, and this is something we were complaining about in other training programs. But now, with this program, there's a big difference. The nurses have started to act, to discuss, and even to get up and give a presentation.
Through this program, we started to think. What am I going to say? How am I going to participate? What am I going to contribute in the coming team meeting? How can I become aware of situations around me so that I can explain them in the meeting? And we started to think, what are the obstacles at the center so that we can improve our services to women and children? We started to realize that we had capacities that weren't used. We started to make requests for support from people who could help us.
After the leadership program, things changed. Each of us had a separate responsibility. Work changed for us.
In the beginning, when someone was absent, no one would take his place. But now we all care about the results that have to be reached every month.
We set a goal to increase our service capacity so that we could serve an additional 20% of the family planning needs of our community. The plan was to increase our ability to serve family planning needs over 6 months, from being able to manage 7,500 family planning clients to being able to manage 9,000.
The heart of the program is a tool called the challenge model. It is used to clarify a team's mission, enable a shared and inspiring vision of the future they, their colleagues, and their communities want to reach, and identify a measurable result to move the team toward that vision. Teams analyze their service statistics to understand their current situation. Then they analyze the causes of the gap between the current situation and their desired measurable result. With this information, they develop an action plan or work plan to align and mobilize facility, staff, and their communities to take them from their current situation to their measurable result and ultimately to their shared vision, evaluating their progress at the end of set periods of time. The results speak for themselves. 75% of the original 10 health teams achieved 95% or more of their desired results, and 80% of the teams selected a new challenge without being prompted. What differentiates this leadership development approach from performance improvement and other quality improvement processes is the commitment that comes among health personnel from creating a shared vision, owning the challenge, working as a team to apply leadership practices to address the challenge, and taking on ever greater challenges as they gain experience and confidence.
When we started the program, we pursued our challenge to reduce unmet need for family planning, and we exceeded our goals. And we also increased the number of children that were vaccinated.
When a team takes on a challenge, all of the organization's services get better. Even though this team tackles just one challenge, and that is the proof of success of Aswan.
I think very highly of this center because I come here all the time and they take care of my children, and the organization is very good.
Each year, the self-directed and self-supported leadership development program grew, expanding to new teams and health facilities throughout the Aswan governorate. After 3.5 years, all 185 health facilities in the governorate had participated in the leadership development program, using local resources and local facilitators.
In the beginning of the training sessions, I learned what was required, and I began to survey all the problems that we had.
Dr. Walid was part of the third generation of the leadership development program and utilized the skills and tools he gained to successfully tackle a growing healthcare challenge in his community.
One day, a woman came to us, and she had her daughter with her, and when we examined her daughter, we found she had a heart palpitation. The small girl had rheumatic heart disease, and when the mother learned that, she started to cry.
Dr. Walid took on the challenge of finding a way to diagnose and treat rheumatic heart disease among the area's children before it seriously impacted their health.
We started with 2 villages that were near each other, and we made home visits. You are going to go to the village house by house, exactly as you do with the vaccinations.
The teams went into the villages and scanned for symptoms of the disease. They discovered 14 undetected cases of rheumatic heart disease. Through the efforts of each member of the team, the disease's advancement in the children was halted before serious heart complications emerged.
So everyone on the team has their own measurement to determine their success and to be satisfied with. That is the difference between other training programs and the kind of leadership development that this program introduced.
Thank God all the healthcare indicators have improved. And this is important in gauging the program's success. But I personally know about the success that happens in the units, not through the statistics, but through the eyes of the people who are working there. When I look at the eyes of the worker, I know from his or her eyes whether they have success or not.
The leadership program positively affected all of us, everybody who trained in the program. First of all, in my private life, I used to have obstacles and I didn't know how to overcome them. But after the beginning of the leadership program, I started to make goals to achieve every day.
The Aswan Health Directorate holds annual conferences for leadership development program participants to share their achievements and the lessons they have learned with other participating teams, as well as with Central Ministry of Health and Population officials and local government leaders.
At first, I was a participant, and then I became a facilitator and was able to take the leadership program to other places.
This project doesn't need money. It doesn't need equipment. It needs the human being. And the human being in Aswan is a great resource.
Now we can overcome the obstacles that we face. And now we hope that all the workers, not only those in Aswan, but in other governorates, will do the same things.
The success of Aswan started small. From a few local ministry facilitators, the program has expanded to 35 facilitators who are bringing the Leadership Development Program to other governorates in Egypt using Ministry of Health resources. The program's success has even led ministries of health from other countries to adopt its principles and approaches to empower healthcare workers to lead and manage teams with their own resources.
Leadership is a life program. It's not died. If you put the seeds of leadership in the heart of anyone, it continues with him. And so I hope that leadership program extend to other governorate in Egypt. And in Aswan itself, I hope that leadership not only applied in the health sector, but to the other sectors, to education sectors and to every sector in Aswan. This program has the principle of success inside it. And I know that this program can succeed in other governorate and in other countries. And I have a good example. You know that Afghanistan came to Aswan last summer, and they trained in leadership program, development program in Aswan. And they go back to Afghanistan, and they do very, very good work there. So we can move this program to many countries, because it not need many money, not need a very big fund. It can be applied in low resources countries, and so it can easily be applied and be moved to another countries. The very important thing that the poor patient in Aswan now benefit from leadership in terms of good health care.
As a result of women having more access to family planning services, receiving more antenatal care and child care visits, and having more deliveries by trained medical staff, the healthcare outcomes in Aswan have improved.
Neonatal mortality, infant mortality, children less than 5 years decrease. Maternal mortality decreased. All the indicators in Aswan now is very good, and this is I'm proud of that.
كفان عليك يا حبيبي تسلاني يهون عليك يا حبيبي تسلاني وتنصعد في عليك